I spent my life saving animals, but I never imagined my own body would betray me the way it did. At 28, I was a veterinarian who could diagnose bone marrow suppression in dogs within minutes. Yet I missed all the signs when my own bone marrow stopped producing the blood cells keeping me alive. My name is Rebecca Thompson, and I dreamed of being a veterinarian since I was 5 years old, bandaging my stuffed animals and setting up elaborate hospitals in my childhood bedroom in Portland, Oregon. By the time I graduated from Oregon State University's College of Veterinary Medicine, I'd accumulated $180,000 in student loans and an unshakable belief that I was meant to heal creatures who couldn't speak for themselves. I worked at Westside Animal Hospital in Seattle, a busy practice that saw everything from routine vaccinations to complex surgeries. My specialty was internal medicine, the medical mysteries that stumped other vets. I had a reputation for being able to diagnose the undiagnosable, for seeing patterns and symptoms that others missed. Dr. Thompson has magic hands, my boss doctor. Patricia Williams used to tell worried pet owners, if anyone can figure out what's wrong with your animal, it's her. Magic hands. If only they could have diagnosed my own condition before it nearly killed me. The irony wasn't lost on me that I spent my days treating animals with blood disorders, autoimmune diseases, and bone marrow problems, while my own immune system was quietly failing. I diagnosed aplastic anemia in countless dogs and cats, explaining to their owners that their pet's bone marrow had stopped producing enough blood cells. I knew the symptoms by heart: fatigue, pale gums, easy bruising, frequent infections. I had all of those symptoms for months before I finally connected the dots. It started in January 2019, during the busiest season at our clinic. Flu season for humans meant heartworm prevention season for dogs, and our schedule was packed with wellness exams and vaccinations. I was working 12-hour days, often staying late to finish surgery notes or call worried pet owners with tests. Results that the fatigue hit me first. I'd always been high energy, the type of person who could work a 14-hour surgery day and still have enough stamina to go for a run. But suddenly, I was exhausted after 8 hours. By mid-afternoon, I felt like I was moving through molasses. I started drinking more coffee, taking vitamins, blaming it on the long winter and lack of sunlight. "You look tired," my colleague, Dr. Michael Chun, mentioned one Thursday morning as we prepped for a complicated stomach surgery on a golden retriever who'd swallowed a tennis ball. "Everything okay?" "Just busy season," I said, scrubbing my hands with more force than necessary. The soap stung with small cuts on my knuckles, cuts that seemed to appear out of nowhere and take forever to heal. The bruising started in February. I'd find purple and yellow marks on my arms and legs that I couldn't remember getting. Working with animals meant occasional scratches and bumps, but these bruises were different, larger, darker, appearing without any trauma. I could recall my girlfriend Jessica noticed them first. We'd been together for 2 years, living in a cozy apartment in Capitol Hill with our rescue dog, Charlie, a mixed breed we'd adopted from the shelter where I volunteered on weekends. "Becca, what happened to your leg?" Jessica asked one morning. As I got dressed for work, she was pointing to a bruise the size of a softball on my thigh, dark purple with yellow edges. "I don't know," I said honestly. "I must have bumped into something." "But it's huge," she said, concern creeping into her voice. "And you have another one on your arm. Maybe you should see a doctor." See a doctor. The irony was that I was a doctor, just not the right kind for humans. In veterinary school, we'd learned about zoonotic diseases, illnesses that could transfer from animals to humans, but we'd only gotten basic training in human medicine. I knew enough to be dangerous, but not enough to properly diagnose myself. Made an appointment with my primary care physician, Dr. Sarah Rodriguez, for the following week. But before I could see her, everything accelerated. It was a Tuesday morning in March when I collapsed at work. I was examining a sick cat named Whiskers, a 12-year-old tabby whose owner was worried about his decreased appetite and lethargy. As I palpated his abdomen, checking for masses or organ enlargement, the room suddenly started spinning. Dr. Thompson, the cat's owner, an elderly woman named Mrs. Peterson, sounded alarmed. "Are you all right?" I tried to respond, but my vision was tunneling and I felt like I was going to vomit. The next thing I knew, I was on the floor of the exam room, staring up at the ceiling tiles I'd looked at thousands of times from the other direction. Dr. Williams rushed in, alerted by Mrs. Peterson's panicked calls for help. She knelt beside me, checking my pulse and looking at my coloring with the same clinical assessment she'd use on a sick animal. "Rebecca, can you hear me?" she asked. "You're very pale." "How long have you been feeling unwell?" "How long?" "Months," I realized. I'd been sick for months and had been too busy, too stubborn, too convinced that I was just tired to pay attention to what my body was trying to tell me. The ambulance ride to Swedish Medical Center was a blur of sirens and concerned paramedics, asking questions I couldn't focus enough to answer properly. Jessica met us at the emergency room, having left work the moment Dr. Williams called her. "What happened?" she asked, holding my hand as they wheeled me into a treatment bay. "I don't know," I said, which was becoming my standard response to everything. I didn't know why I was so tired, why I bruised so easily, why a simple physical exam had made me collapse. For someone whose job required precise diagnosis and treatment, not knowing was terrifying. The emergency room doctor, Dr. Jennifer Lee, ordered a complete blood count and basic metabolic panel. When the results came back an hour later, her expression told me everything I needed to know before she said a word. "Rebecca, your blood counts are extremely low," she said, pulling up a chair beside my bed. "Your white blood cell count is 1,200. Normal is between 4,000 and 11,000. Your red blood cell count and platelets are also significantly decreased. Pancytopenia." The medical term floated through my mind automatically. Dangerously low counts of all three major blood cell types. In veterinary medicine, this usually meant one of two things. Either the bone marrow wasn't producing enough cells, or something was destroying them faster than they could be made. "What does that mean?" Jessica asked, though I could see in her eyes that she knew it wasn't good news. "It means we need to figure out why her bone marrow isn't working properly," Dr. Lee explained. "The most likely causes are aplastic anemia, certain autoimmune conditions, or occasionally leukemia." Leukemia, the word hit like a physical blow. I diagnosed leukemia in dozens of animals, watched their owners cry as I explained treatment options and prognosis. Now I was the patient, and someone I loved was hearing that same terrifying word. They admitted me immediately for further testing. The next 3 days were a parade of specialists, blood draws, and diagnostic procedures I'd referred countless animals for, but never experienced myself. A bone marrow biopsy where they inserted a large needle into my hip bone to extract samples of the spongy tissue responsible for producing blood cells. CT scans to check for enlarged lymph nodes or organ involvement. Genetic testing to look for inherited disorders. The hematologist, Dr. Amanda Foster, was a kind woman in her 50s who specialized in blood disorders. She sat with Jessica and me in my hospital room on Friday afternoon to discuss the results. "The good news is that we've ruled out leukemia," she said. "The bone marrow biopsy shows no evidence of cancer cells." Relief flooded through me, but I could see from her expression that there was more to discuss. "The challenging news is that you have severe aplastic anemia," she continued. "Your bone marrow has dramatically decreased production of all blood cell lines. Without treatment, this condition is fatal. Fatal. I was 28 years old, and we were discussing my mortality. What kind of treatment? Jessica asked, her voice steady despite the tears in her eyes. There are two main options, Dr. Foster explained. Immunosuppressive therapy, which involves medications to suppress your immune system and allow your bone marrow to recover, or a bone marrow transplant, which would replace your faulty bone marrow with healthy cells from a donor. She went on to explain that immunosuppressive therapy worked in about 60% of cases, but took months to be effective and came with significant risks of infection and organ damage. A bone marrow transplant was more definitive but required finding a compatible donor and carried its own set of serious risks. The first step is finding out if you have any siblings who might be a match, Dr. Foster said. Siblings have a 25% chance of being compatible. Siblings. I was an only child. My parents, both in their early 60s, were too old to be donors. My extended family was small, a few cousins scattered across the country, most of whom I hadn't spoken to in years. What if she doesn't have a compatible family member? Jessica asked. Then we searched the National Bone Marrow Registry, Dr. Foster said. There are over 30 million registered donors worldwide. The challenge is finding someone who matches Rebecca's specific genetic markers. My parents flew in from Portland, and we started the process of testing anyone who might be a potential donor. My cousins, aunts, uncles, anyone willing to undergo the blood testing that would determine compatibility. None of them were matches. While we waited for the registry search, my condition continued to deteriorate. My white blood cell count dropped even lower, making me vulnerable to any infection. I was placed in isolation, with everyone who entered my room required to wear gowns, gloves, and masks. The irony wasn't lost on me that I'd spent years protecting sick animals from infection, and now I was the one who needed protecting. Jessica practically moved into the hospital, sleeping in the uncomfortable chair beside my bed and advocating for me when I was too weak to speak for myself. She learned medical terminology, asked questions about every medication and procedure, and became my link to the outside world. Charlie misses you, she told me one evening as we watched the sunset through my hospital window. He keeps checking your side of the bed and whining when you're not there. Charlie. My heart ached thinking about our dog, who'd been rescued from neglect and had trusted us to keep him safe. Now I couldn't even keep myself safe. The first potential match came through 6 weeks after I was hospitalized. A 34-year-old man from Texas, whose tissue type was compatible with mine. Dr. Foster was cautiously optimistic as she explained the next steps. He's willing to be a donor, she said. We'll need to coordinate schedules and make sure he's medically cleared for the procedure, but this could be exactly what we need. For the first time in weeks, I felt hope. Someone I'd never met, a stranger in Texas, was willing to undergo a painful medical procedure to save my life. The bone marrow donation process involves daily injections to stimulate stem cell production, followed by a several-hour procedure to collect the cells. It's not dangerous for the donor, but it's uncomfortable and requires a significant time commitment. We scheduled the transplant for 3 weeks later. I spent those weeks getting my body as ready as possible, intense chemotherapy to wipe out my remaining bone marrow, medications to prevent rejection, and careful monitoring of every system in my body. Jessica and I started planning for my recovery. We talked about the months of isolation I'd need post-transplant, the gradual return to work, the possibility of having a normal life again. She researched everything about bone marrow transplants, creating detailed schedules for medications and follow-up appointments. This time next year, you'll be back to saving animals, she said, holding my hand as we watched a medical drama on the hospital TV. Dr. Patricia says your job will be waiting whenever you're ready. Dr. Patricia Williams had been incredibly supportive throughout my illness, covering my cases and keeping me informed about my regular patients. She'd even brought photos of animals I treated, including a golden retriever puppy who'd grown from a sick, malnourished rescue to a healthy, happy dog during my absence. "You saved his life," she told me during one of her visits. "And now, it's time to save yours." But then, just 48 hours before my scheduled transplant, everything fell apart. Dr. Foster called my room on a Thursday evening, and I could hear the disappointment in her voice before she said a word. "Rebecca, I'm so sorry to have to tell you this," she said. "The donor from Texas has backed out. His family is concerned about the risks, and he's decided he can't go through with the procedure." The room went silent except for the constant beeping of my form machine. Jessica's face went pale, and I felt like I'd been punched in the stomach. "What does this mean?" I asked, though I already knew the answer. "It means we start the search over," Dr. Foster said gently. "I know this is devastating, but there are other potential matches in the system. We just have to find them." Start over. After months of hope, after weeks of preparation, after believing I'd found my salvation in a stranger's generosity, we were back to square one. That night, alone in my hospital room with Jessica sleeping fitfully in the chair beside me, I cried for the first time since my diagnosis. Not from pain or fear, but from the crushing weight of disappointment. I'd gotten so close to having my life back, and now I was facing months more of uncertainty. But I was Rebecca Thompson, and I'd spent my entire career fighting for animals who couldn't fight for themselves. Now it was time to fight for myself, even if it meant starting the battle all over again. The search continued, and after 6 more weeks, we found another match. This time, a 29-year-old woman from California who was not only compatible but eager to help. The transplant was scheduled for July 15th, exactly 1 year after my initial diagnosis. "Third time's the charm," Jessica said as we prepared for another round of pre-transplant conditioning. "I can feel it." And she was right. The transplant went perfectly. The donor cells engrafted quickly, and within weeks, my blood counts started climbing toward normal ranges. After 14 months in and out of hospitals, I was finally on the path to recovery. 9 months later, I returned to work at Westside Animal Hospital. My first patient was a 6-month-old kitten with anemia, a condition I now understood from both sides of the stethoscope. "Dr. Thompson," the kitten's owner said as I examined the tiny orange tabby, "thank you for taking such good care of her." "Thank you for trusting me with her care," I replied, listening to the strong, steady heartbeat that represented everything I'd fought to return to. "I am Rebecca Thompson, and this is how I learned that sometimes the healer needs healing too."